Good afternoon, and I hope everyone had an enjoyable weekend. Today, we're going to be talking about the continuing progress that we're making in our case numbers. Things definitely are improving, and that's because of your efforts and that of many others who have taken the precautions and actions necessary to slow the spread. But just because things are improving doesn't mean that we can ease up. We need you to continue being vigilant. I know my alma mater, San Diego State University, is starting the fall semester this week with online classes. We welcome back those students who have returned for the school year, but we ask that you please be careful and avoid large gatherings. For business owners, we know you have questions about businesses reopening now that we're off the state's monitoring list. As of today, we still have not received clarity from the state on guidelines for businesses to reopen more fully. We do not know yet when we will get these guidelines. We certainly hope it'll be within a week or so, and we are keeping in contact with the state on that issue. We know how important it is to so many businesses. Even when we get those guidelines, we're going to have to move slowly and carefully. We've worked really hard to get off the watch list, and it would be dangerous and certainly very frustrating for all of us to open carelessly and set us back. Finally, you may recall that a couple of weeks ago we mentioned that our County Board of Supervisors approved expanding the popular Great Plates program that works with local restaurants to provide daily meals to our vulnerable seniors. I'm happy to announce that as of today, enrollment has been open for additional participants to apply. These new participants will be paired with a local restaurant and will receive 3 nutritious and tasty meals a day. In addition to this expansion, the board also voted to take the Great Plates program to a new level and create an additional version, Great Plates 2.0 Dinner Delivered. This program is intended to fill a gap that we found in the original state's model and will provide 1 hearty meal a day to adults of all ages who are living with a health condition or disability that makes it difficult to prepare or obtain meals. These individuals were not previously eligible for Great Plates Delivered, and we are happy that we are able to expand the program and their reach to serve these people in this way. Again, participant enrollment is now open for both Great Plates programs. There are eligibility requirements. You can learn more or apply by visiting www.aging.sandiegocounty.gov or calling the Aging and Independent Services Call Center at 1-800-339-4661. That's 1-800-339-4661 and selecting option 7. With that, we're going directly to our updates. We do have a very special guest with us today, Chris Van Gorder, who is the president and CEO of Scripps Health. He's going to be talking about reopenings and the impact on our hospitals. But first, we'll hear from Supervisor Fletcher and then our public health officer, Dr. Wilma Wooten.
Thank you, and good afternoon. As Chairman Cox mentioned, we are awaiting state guidance surrounding reopening. The governor today did say we should expect to see that this week in terms of guidance for counties that have come off of the monitoring list. And while we know everyone is eager to see that, we want to re-emphasize the need that we have to move cautiously as we go forward. We had a significant spike in our cases, which put us on the state monitoring list. When we took those actions to tighten restrictions, we saw the number of cases come down significantly, which is what got us off the state monitoring list. And so if we were to move too swift in undoing those, it is only logical that we would then spike again. And what we desperately want to avoid in San Diego County is the on the list, off the list, open, close scenario. What is most important is that we stay off the state monitoring list, that we keep our case count low. This is most important to preserve life and preserve the integrity of our healthcare system. It's also the most important thing economically, to ensure that we have a smooth and steady recovery, that we aren't having businesses go through the hurdle of opening to then have to reclose. And so as we move forward, we really need to be mindful that the goal is to slow the spread, to keep our numbers down, to keep our metrics down, and to stay there. And so we have to proceed with a great degree of caution to make sure that we don't backslide. We've done a great job this last month. We did a great job at the very beginning of this, Where we flattened the curve, loud reopening, we saw things spike. We did a great job in slowing the spread and getting them back. And the goal moving forward is to make sure that we stay in that posture and situation and that we act responsibly, again, not only for our healthcare system, but for our economy. We are also coming upon a period of time where schools are going to begin to reopen. A number of elementary schools have already had their waivers approved, and they could be resuming classes in the very near future. And of course, on September 1st, we'll mark 14 days, assuming our cases remain low, that we've been off the state monitoring list, where all schools will have the option of reopening. On Wednesday, we will be sharing the details of our efforts around testing for teachers and school personnel, along with what's available for kids who might be considering going back to school. And we have colleges and universities that are also resuming some in-person, some distance learning, but a lot of folks coming back. And we have to closely monitor and watch what is the impact on our cases from this step that we're taking. And so as we move forward, I think we just want to continue to urge caution. We know at times it's easy to get impatient. It's easy to forget where we were just a day or a week ago. But we have to continually be mindful of what can happen with coronavirus, the very real danger of exponential growth and spread, and what it could mean. We've seen the very dire impacts and implications on surrounding states and surrounding counties. We've done good as a region, and we want to continue to be in that situation. And it will be good to hear today from Chris Van Gorder at Scripps Health to just reinforce and remind ourselves of the impact on our healthcare systems, what our healthcare workers are facing every day, and remind ourselves of the importance of trusting our medical experts and doctors as we guide our way through this. So again, we want to continue to move forward. We want to do it responsibly, and we ask for everyone's continued help and patience and vigilance as we come together as a community to get through a very difficult time. With that, let's jump into our update for today. We'll start with our T3 numbers. You see our 7-day average of testing, again, holding strong, just under 7,400, well in excess, again, of that goal of 6,740 per day. And our public health labs continue to turn around our test results very quickly, as do our hospital system partners, to get the speed of those to allow for the proper contact tracing. You see our 14-day percentage of new cases, again, continues to be good, 3.5. This is encouraging. We want to stay on this trajectory and trend, and 784,836 total tests reported to us. You can see our contact tracing case investigations, 96%, 81% of close contacts traced within 24 hours. We're going to work to bump that up a little bit, but over 41,000 case investigations performed to date, and the treatment numbers you see there on the right-hand side. Today, we're reporting 187 new positive cases out of today's 7,351 for a 3% percentage of positive. Again, the purple line there representing our 14-day rolling average of percentage of positive, trending in a downward direction, something that's encouraging, but something we want to continue to have happen. Daily hospital census, we're looking at 102 in our ICUs, 275 total ICUs up just a little bit, total hospitalizations down just a little bit, holding relatively stable over the preceding week. In terms of our total hospital census, both COVID and non-COVID, we're taking the 275 COVID at the bottom there, 4,244 total hospitalizations. Again, you see the 80% bed occupancy line there, so holding relatively stable. And then finally is our ICU utilization. Again, COVID-related 103, non-COVID 354, having us at 65%, which again has been a benchmark and trend for many weeks now, holding relatively stable. That concludes my section of the report. I'll turn it over to Dr. Wooten, our public health officer.
Thank you, Supervisor Fletcher, and thanks to everyone for being at today's briefing. All global, national, and state statistics are based on data that we retrieved from the Johns Hopkins dashboard that was obtained today around noon. Today's local statistics for San Diego County are from reports as of 11:59 yesterday on Sunday night. Today, there is a total of 36,727 cases, which is 187 more cases than yesterday, and a decrease in new cases since yesterday's report of 337 cases. To put this total number of cases into perspective, this is equivalent to the number of seats at Petco Park, excluding the box seats. The overall total number of cases includes 660 deaths. We've had no new deaths reported since yesterday, which is the usual for the beginning of the week. The age range for all of our cases is the same and is holding at 3 months to 102 years of age. The age group between 20 and 49 years of age remains at 59% of the total number of cases, represented by 21,591 cases. For gender, we have 51.5% represented by female and 48.5% represented by male, and 107 individuals has no gender identification. So, for hospitalized patients, 2,986 or 8% of the cases have been hospitalized, and this includes 733 individuals that have been admitted to the ICU. This number is 2% of the total number of cases and 25% of the total number of those hospitalized. The next slide shows COVID-19 demographics related to hospitalized cases. The majority of our hospitalized cases, 2,121 or 71%, of the 2,989 total hospitalized cases are among the 50 years of age and older age group. Males represent the majority of hospitalizations at 54%, which is also 1,621 cases. Latinos or Hispanics represent the majority of hospitalizations at 62%, or 1,722 cases. The 660 total deaths represent 1.8% of the total number of cases, and this is also our county's case fatality ratio. Of the deaths, 283 or 43% were female, 377 or 57% were male. 633% or 96% of the total death cases had underlying medical conditions, and 27 or 4% did not. And I know when I say our county colleagues join me in extending our sincerest condolences and sympathies to the family and friends of those individuals that have been lost to COVID-19 disease. Next, I'd like to discuss a summary of all of our outbreaks. Since the beginning of the pandemic, 382 total outbreaks have occurred in 3 categories: skilled nursing facilities, non-skilled nursing facilities or other congregate settings, and community settings. Of the 382 outbreaks, 255 or 67% are now closed or inactive, meaning there have been no new cases reported at these settings in the past 14 days or longer. This leaves 127 or 33%, and approximately 1/3 of the 382 outbreaks being active outbreaks. Of these 127 active outbreaks, 30 or 24% of the 127 number are in skilled nursing facilities. And there are 86 skilled nursing facilities in San Diego County. In this setting, there have been 825 residents and 541 staff members with laboratory-confirmed COVID-19, and includes 156 deaths. 33 or 26% of the 127 active outbreaks are in non-skilled nursing facilities or other congregate settings. In this category, there have been 753 residents and 584 staff members reported as being positive, and includes 107 deaths. Lastly, 50% of the 127 active outbreaks are in community setting locations. This next slide shows all 122 active and inactive community setting outbreaks since March 25th by month, which accounts for 1,555 cases. Note that July has the largest number of outbreaks with 93, and keep in mind only 64 of the 222 community outbreaks are still active. Now, the next slide shows all 222 outbreaks by community setting, and the top 3 Settings include 56 outbreaks in restaurants/bars and 14 in restaurants, so those are grouped together, 58 in various businesses, and 20 in healthcare settings. Since March, the total community outbreaks have produced 1,555 laboratory-confirmed cases, including a total of 12 deaths. Moving on, let's now review our 13 triggers for San Diego County. These triggers help to determine what actions will be taken if we need to modify the health officer's order. Trigger number 1 is normal, but I'd just like to update you on where we are with this, because this was the trigger that previously had us on the state's monitoring list. And today, actually, we are halfway through the 14-day waiting period before we can open up schools. A tremendous and enormous thank you to all of the businesses and individuals and all of the sectors that help to bring our total number of cases and hence our case rate down and moving in the right direction. Now, next look at the actual trigger that is abnormal, and that is community outbreaks. And the metric here is no more than 7 outbreaks over the last 7 days. And today we are reporting 20 total community outbreaks for the past 7 days from August 17th through August 24th. And this represents also 73 cases. Overall, shown here in the next slide are the 20 outbreaks by settings. Next slide. Which includes 8 outbreaks in businesses, 1 in a faith-based organization, 2 in grocery/retail locations, and 1 in a gym or fitness facility, 1 in a healthcare setting, 1 in a hotel, resort or spa, 2 in restaurants only, and 5 in restaurants or rather 4 in restaurants/bars. And today, 5 new community outbreaks have been added to our list, and they are noted here. There are 2 in businesses, 1 in a restaurant, 1 in a hotel, resort spa, and then 1 in a grocery store. So lastly, today we are unveiling an update on the county webpage regarding COVID-19, next slide, by race and ethnicity. As you may have noted, to date, we have made cases, hospitalizations, and death data available by race and ethnicity. That is currently already on our COVID-19 webpage. And at the close of business today, additional information on testing, staffing, and geographic data will be provided. The data for tests provides the total number of all tests reported to the County of San Diego. This is in this slide, by zip code of residence, which includes tests for San Diego County residents only, plus tests with addresses outside of San Diego County and tests with incomplete addresses / zip codes. The next slide, and this basically shows where you can find this race and ethnicity data on our website. When you go to the website, you will then click on the graphic that shows the map with the stick pin. When you click on that, you will see what's on the left side of this slide, and at the very bottom, you will see a link for COVID-19 by race and ethnicity, which is on your right side of this slide at the very top. And that's where we will post after information by cases, hospitalizations, and death. We will post the information related to test, staffing, and geographic information. So in closing, I want to stress that this pandemic is not anywhere being over. Each and every one of us has a role to play in our regional success and getting through this pandemic. Keeping up the momentum will require emphasis on the elements that are shown here on this slide. And this includes washing your hands frequently, properly, and conducting the appropriate sanitation in your environments. keeping 6 feet apart from others, wearing facial covering, and avoiding crowded places, as well as staying home when you are sick. So thank you for helping us get to where we are now, but we need you to stay vigilant and continue your efforts. Now, please welcome back to the podium Chairman Greg Cox. Thank you.
Thank you, Dr. Wooten. As I mentioned in my opening comments, we have a special guest with us today, and that's Chris Van Gorder, who's the president and CEO of Scripps Health. You know, one of the things that we've been dealing with this pandemic is just tremendous cooperation between our county public health officials and our public health hospitals in the San Diego region. And certainly Chris has been right there with all the other hospitals and working hand in hand with the county of San Diego. Chris is going to talk a little bit about reopenings and certainly fill us in regards to how the hospitals have been handling this pandemic. Chris?
Thank you, Chairman Cox. Well, good afternoon. I'd like to make several brief points today. First of all, I'd like to thank all of the hospitals and health systems for their outstanding work during this pandemic. The collaboration and support for our community, our county, patients, and each other has been unprecedented, and every acute care hospital in this county has cared for COVID patients. I'd especially like to call out the collaboration with Sharp Healthcare. As you know, Scripps Health and Sharp Healthcare have cared for the large majority of the COVID patients in this county. I was in contact with Dan Gross before he retired, and Sharp COO Brett McLean every day since this pandemic started, sharing information and collaborating. I think it's important for the community to know your healthcare systems are working together. I'd like to thank the county and our other public health colleagues as well. That's the other group I've been in contact with daily. Together, the county public health officials and all of the hospitals have been working together to serve our community. Second, I want to tell the general public that our hospitals and clinics are open and they're safe. When the pandemic started, every healthcare provider stopped performing non-emergent surgeries and procedures to protect very scarce supplies and to make sure that we had the capacity to handle any patient surge. It also gave us the time necessary to develop the safety systems to protect patients and staff. Today, our hospitals and clinics are again open with the systems and procedures necessary to protect you if you need to see your physician or need to come to the hospital. Delaying care can be dangerous, so I'd encourage you to go to the hospital and go to your doctor if you need care. Third, as reported by Dr. Wooten and County Public Health, our case count of hospitalized patients and positive testing rates is decreasing. Nobody wants to celebrate that more than the doctors and the nurses who have been caring for COVID patients. As you can see from the graph, the reason the numbers are improving is because of the difficult decisions that the state and county made with public health regulations, requiring some business closure, the wearing of masks, physical distancing, washing hands, and avoiding groups. When the business restrictions were eased, the positive cases increased, as did the hospitalizations and sadly the COVID deaths. When the restrictions were reintroduced, the numbers improved, and now we're seeing roughly the same number of cases we saw last April. So what does that tell us? It tells us that we need to continue many of the restrictions currently in place. And if we decide to ease those restrictions, we need to do so slowly and deliberately, making sure we don't create another spike. Most importantly, the public must realize that the easing of restrictions and the opening of some schools does not mean this pandemic is over. On the contrary, it is not over. This dangerous virus is community spread and will grow again in our community if we're not smart and diligent in how we manage. And lastly, I want to thank all of the healthcare providers in our community wherever they work. I especially want to thank the doctors and nurses and support staff at Scripps Health. Today marks the 194th day our COVID Corporate Command Center has been in operation, the longest emergency situation I've ever been involved with. This pandemic is taking a significant toll on healthcare providers. Early on, we called them heroes, but lately I'm not hearing that as much. Our people have been yelled at and even attacked for asking people to put on a mask before they enter a healthcare facility. And the emotional toll of caring for patients, any one of whom could be COVID positive, has been extremely difficult. Two of my nursing managers wrote to me last week after I taught a virtual class that included showing a video of care of a COVID patient being cared for by ECMO. That's an artificial lung. That's the last treatment we can give to a patient who can no longer support their own breathing. The video evoked strong emotions. From a nursing manager in the north part of our system, that ECMO video really resonated with my experience through all of this. I am so grateful to Scripps for committing the time and resources to help the community really see reality at the front line. Sometimes it feels like I live in two alternate universes. At work, I see the reality of people impacted by COVID, the patients and the staff. It is so real. And then I go home and I'm treated like I'm being overly dramatic or being crazy taking precautions. It's like a bad dream where you're standing in a room screaming at the top of your lungs and nobody can hear you. From my manager at Scripps Mercy Chula Vista, one of our hardest hit hospitals with COVID. What pulls at my heartstrings is the change I see in the staff. They were initially very anxious and afraid, and now they are tired of being afraid, and yet they're still afraid. Every time I called someone to tell them that they were potentially exposed to COVID, it was like telling them they had cancer. I can't even count the number of times I've cried with them as they describe their home life situations and how all of this fear has impacted their life. Some have not seen their loved ones in months. Grandparents, aunts, and uncles can't see their newborn babies. As you and others talked about the numbers, I think of the human lives that were impacted by those numbers. When I see that our youngest death was 23 years old, I know exactly who that 23-year-old was and what were the circumstances of her death. She was our first death, and she died alone. Her mother and father could not be at her side. I pray for her still. As of this morning, 189 COVID patients have died at Scripps hospitals. None of them were a statistic. Please go slow with the reopening. Wear a mask, physical distance, wash your hands, avoid groups. The COVID is not done yet. Thank you.
Thank you, Chris, and thanks to all of our hospitals in San Diego County for working so closely with the county over these last few months on this COVID pandemic. With that, we'll go straight to the questions.
First question is Priya Shrida, NBC7.
Hi there. We saw the Awakened Church have services again this weekend, and I know you guys have tried to go to educate them and give warnings and serve them with cease and desist orders. At this point, what more can you do to encourage them not to have these gatherings? And if you can't do anything more, do you think you need to find more effective tactics to ensure that people are complying with the public health order?
Okay, Supervisor Fletcher is going to respond.
Thank you, Priya. You know, California recognizes the right of individuals to gather for religious purposes. It's enshrined in the First Amendment in our Constitution to petition your government for a redress of grievances and to gather in protected religious activities. And that is why religious services are one of the only entities that are allowed under the public health order to have an unlimited number of individuals gather together to express their religious beliefs. It is allowed under the public health orders to do that. You just have to do it outdoors. You physically distance, you utilize a face covering, and then you can move forward. And so it is very frustrating and very disconcerting to have an entity who has the capacity and ability to gather in a safe outdoor setting to choose to go back indoors. And the concerning part is because we've seen the extreme danger that is presented from large indoor gatherings of individuals for extended periods of time. We have seen countless examples across this country of faith leaders who have contracted and died of COVID, of significant outbreaks that are tied to large indoor religious service gatherings. And so it's irresponsible when they are provided a safe path and avenue and option to move forward. I think there's a lot of us that feel that we have an obligation to look not only out for our own interest, but for the interest of others. That we have an obligation to help protect the least among us. That we come together out of a desire to protect one another. And so it is very frustrating to see an entity that has an avenue together, that is allowable, that is acceptable, that is much safer, choose to openly defy that in order to expose the members of their congregation to a very dangerous situation. And it's not only the members of their congregation, but it is the rest of the community. And so we will continue to explore every option that we have, and we will continue to try and appeal to the better angels of our society to get folks to come together. And again, we respect the right of individuals. It's written into our Constitution together. which is why it is allowed for, specifically spelled out under the public health orders. Just gather outdoors, physically distance, wear a face covering, and move forward responsibly. And so we'll continue to look at what options we have and say a special thank you to those faith leaders across this county who are choosing to gather and worship and share together in a responsible way. Thank you.
Okay, next question.
Brandon Lewis, CBS 8.
Thank you. We've heard you guys talk a lot about community tracing efforts, and I'm wondering if you could explain what happens if a county resident contracts the virus over state lines, maybe in Vegas or Phoenix. How difficult or easy is it to figure out if there's an outbreak happening over there? And conversely, what if a visitor were infected here and it wasn't apparent until they went back to their home state?
Okay, Dr. Wooten's going to respond. Oh, Dr. McDonald's going to respond.
Thank you. Is this one working or is this one? Right. Yeah. Thank you for that question. Actually, we work closely with the public health agencies of other counties and through the state, other state and county agencies outside the state. We also work with tribal public health authorities and also military jurisdiction health authorities to do joint investigations. So the scenario you're describing of a San Diegan in another location who is diagnosed elsewhere, who then comes back to San Diego, even if they don't come back, we find out. We get that information and we work with that jurisdiction where the diagnosis occurred in order to do the contact tracing. About 10% of all of the positive cases that we have here in San Diego are non-county residents, and we publish that number in our weekly report every Tuesday. And so in each and every one of those cases, we are reaching out often through the state, or if it's one of our neighboring counties, we work directly with those jurisdictions in order to do the joint investigations.
Thank you. And did you have any rough numbers on how many San Diegans may have contracted the virus in another state?
That's a great question. I don't know off the top of my head. I can tell you that on a daily basis, we do get laboratory reports from out of state, often by other state or county laboratories. We get them every day. I remember one day we had about a dozen in one day from Texas for some reason, but we don't know the exact number, but I can look into that for you.
Thank you, Doctor.
We have one last call-in question.
That one is Taryn Mento with KPBS.
Hi, thank you. Chris Van Gorder just said to please be slow with the reopening. I know we're still waiting for the state guidance, but the county has the power to choose to be more strict than what the state may allow. Dr. Wooten, do you plan right now to use that power when the guidance is released, especially because you've seen some proposals of what the guidance could be?
Okay, Dr. Wooten.
And I have another one as well.
Okay.
Thank you for the question. Right now, we don't know exactly what the state is going to be proposing. We did have a call, health officers across the state met with the state leadership in the California Department of Public Health. And we know that the state wants to look at a tiered approach of reopening, but we do not have those clear guidelines, so I don't want to speculate here, but you're absolutely correct. If the state does propose something, we can be more strict. And there have been a few occasions, actually, we mandated facial coverings before the state did. So that's one example of where we have done that. Thank you.
And just to kind of ask in a little bit of a different way, we still are hitting our own trigger on community outbreaks, and Voice of San Diego, Scott Lewis just pointed this out on social media. You know, we've seen a lot of the numbers improve, but not this one. And this one was intended to inform you all when more restrictions may be needed. We've had a lot of restrictions already put into place. So what are we going to do about this number that, you know, has come down a little bit, but has not gone down to what we want it to?
Are you speaking of outbreaks?
community outbreaks.
Yes, community outbreaks. Well, we will continue to monitor and do the same things we have always been doing in terms of depending on where the sector is. If it's restaurants, we have a great relationship and partnership with our Department of Environmental Health, where we have staff that are then deployed to a particular restaurant and go in and conduct an assessment of what strategies need to be improved upon. And that has always worked well, and that is working well during the COVID-19 pandemic. And when schools reopen, we will do something very similar for schools. And now that we have the compliance team activated for all of those pre-outbreaks that are not restaurants, or we will have staff that will be deployed to those locations to conduct an assessment in the various settings, again, to provide education and to correct any strategies that are not being fully implemented. So the outbreak measure is a measure to help us monitor what's going on in the community. And because COVID-19 is community-wide, we expect that we will have outbreaks occurring. When schools open up, we expect that there will be outbreaks, but we have reviewed a lot of the elementary reopening plans, and there's been a lot of great work that have gone into ensuring that those 4 strategies that we talk about all the time in every day's briefing, washing hands, sanitation, facial coverings, as well as social distancing, all of those strategies are well defined in the reopening plans. And if they are adhered to, they can help keep the COVID-19 cases down. Thank you.
Well, I just want to point out there have been a large amount of community.
We lost her?
Sorry, there have been a large amount of community outbreaks tied to restaurants/bars, and so I just want to ask: are you saying that we have had that targeted enforcement or approach to working with them to get in compliance? Are you saying that we need more time to see the benefits of that and those numbers coming down, or do we need to do more of what's already been done?
Well, I think we need to continue to do what we are doing, and restaurants and our strategies can always be amplified. So adhering to those strategies, continuing them, being very dogmatic about implementing them. I tell people, if you see something, report it. We have the tool to do so on our county's website. And we see things even in the communities that we go through as county employees. So we just have to continue to be vigilant and do what we know is right in terms of those top 4 strategies. Thank you.
Thank you, Dr. Wooten.
Dr. Wooten, I have a number of questions about school reopenings. The first one has to do with universities, and this is from Claudia Bucchio with Univision San Diego. So her first question is, are there any specific recommendations for college students who are coming back to in-person classes in San Diego County?
I can't emphasize enough those big 4 strategies that we talk about every day. Not gathering in large groups is very important. Wearing facial coverings, social distancing, all of those strategies, hygiene and sanitation. If those strategies are adhered to and there's not mingling, and we hear about, and you've seen on the news what's going on around the country, and we know some of that is happening here, even in San Diego at some of the colleges. But if people take this pandemic seriously and adhere to those strategies, we can really continue to flatten the curve and to basically decrease the number of cases that occur and prevent additional spread. But it really does boil down to behavior, and people have to really take this seriously. We know that the 61% of, or rather 59% of cases are in that population from 20 to 49 years of age, and of the total number, 25% are in 20 to 29 year of age, and those are individuals that are on our college campuses. So taking the disease seriously and adhering to the strategies that we talk about day in and day out is really the only way that we're going to put our arms around this pandemic until a vaccine is available.
Okay, and she also asks, how is the county working with universities such as SDSU to avoid outbreaks among students like we've seen at other college campuses like Notre Dame or UNC Chapel Hill?
Well, thank you. We have college and university sector meetings with our colleges or our institutions of higher learning, which includes our trade schools as well. And just emphasizing the things that I've just talked about, the big four strategies, and helping the colleges and universities and other institutions of higher education to develop their safe reopening plans and adhere to those strategies. That really can't emphasize enough. If we can do those things, we can help to decrease and prevent the spread of COVID-19. And that's across all sectors.
All right. And last part of her question is, what triggers is the county on the lookout for at college campuses?
Well, the triggers that we have on our dashboard are triggers across all sectors. And certainly outbreaks are a big focus. So we anticipate and will manage outbreaks if they occur or when they occur on our college campuses and when they occur in our K through 12 as that sector opens up or that sector begins to open up next week.
And perfect segue into this question from Cliff Albert from COGO. He asks, first he states, the state guidelines do not require face masks for K through second grade. Do you think they should, and would you recommend it for elementary schools that are opening now or will be opening next month?
Well, we adhere to the American Academy of Pediatrics, which recommends face coverings for all individuals 2 years of age and older. The state guidelines indicate that individuals that are 2 years of age through second grade, it's recommended for facial coverings, and then third grade on is required. And we looked for that language when we are reviewing the safe reopening plans for our K through elementary schools.
All right, and this question, thank you, by the way, is from Mike McKinnon from KUSI. He says, a new study from Sweden came out and found that the COVID mortality rate was between 0.1% and 0.3%. It also found children have an extraordinarily low risk to the virus and aren't really the ones spreading it. Does the data that San Diego County uses reflect these findings?
Well, we have not analyzed the data to the same level that this study, but there are other studies that actually show different information. So I would have to review the study before making any comment on it.
Okay, thank you.
Thank you.
I have one more. This one is from Elliot Spaggett from the Associated Press, and he asks, has the county received guidance from the state on what being removed from the watch list means for resuming normal business, recreational, and other activities? What are the county's wishes, and when is a response expected?
At the top of the briefing today, Supervisor Fletcher shared, based on the governor's briefing at noon today, he stated that there will be guidance coming out later this week. So we as in health officials had meetings with the state interim health officer yesterday, and we did not have any guidance to that note related to reopening up of other sectors. There was not a discussion about the when and the how, with the except that they were looking at a tiered approach, which has not been completely ironed out. We did have a good conversation about metrics, and again, tiering those metrics, but that's not complete yet. So we are waiting, just as is all of the various sectors across the county and the state, Other jurisdictions are waiting with bated breath to get this information because we recognize that businesses are anxious to reopen. But as was stated earlier, if we open up everything at once as we did in mid-June, we will see the same outcomes as we did in late June and early July. So as far as I can tell you, what we're anticipating, a tiered approach to opening up, but the specifics of which we do not yet know. Thank you.
Thank you.
Well, that concludes our questions for today. We will be back here on Wednesday at 2:30, and then we will also tomorrow have a Board of Supervisors meeting starting at 2 p.m., where we will be adopting our county budget for the fiscal year 2021. And there's many proposals that have been put in the budget to help people during this pandemic, and for public health reasons, our meeting tomorrow will be a virtual meeting. You can watch online at social media sites, or you can comment through the county's website at sandiegocounty.gov/telecomments. So until Wednesday, please stay safe and protect yourself and make sure you wear your face masks. Thank you.